After years of heart problems, there is word this morning that former Vice President Dick Cheney may now need a heart transplant. Medical correspondent Dr. Jennifer Ashton is here with the very latest. Jen, good morning.
Good morning.
Now, we talked a little bit over the summer about him having this pump implanted, this LVAD device. What is his situation now when it comes to his health?
Well, let's talk about what we know now. In the last couple of months, he has been out in public more public events, more parties. We also can see by photographs taken of him, he has lost a tremendous amount of weight. It's actually called cardiac wasting, very common in patients with end-stage heart failure. Now, to go back to the device that he had that was implanted in July, it's called an LVAD, so that stands for left ventricular assist device. There's 2 tubes that actually get sewn into the heart, and the port of the device sits just below the diaphragm in the abdomen, and then there's connecting tubes that go outside the body to a battery pack. This device can be used as a bridge to transplant in some cases for patients who are so sick they will not survive until they actually receive a heart transplant, or in other cases it can be used, Erica, as something called destination therapy, where no transplant is planned. They expect to live the rest of their lives with this device.
But it seems that more we talk about the former vice president, it tends to be the thinking that it's the former, that it is this bridge to a transplant, which means he has to be on the transplant list.
Correct.
How does that work? Does he have any priority as the former vice president, and how do his age and health come into play?
Well, very important questions, and these are questions that his doctors will be advising him on and discussing with him, on a regular basis. Basically, in this country, all organ transplants go through a network known as UNOS, and you have no priority based on celebrity status or wealth. What you do have priority status is based on how sick you are. So the sickest patients literally are at the top of the list. There is no age cutoff, so it really varies by center whether they'll take someone who's 69 years old, as Dick Cheney is. Obviously, they prefer patients to be younger because they want to implant organs in people who are expected to live longer. So not good news that the sicker you are, the more likely you are to receive a transplant. In this country, 3,000 people are on the waiting list for a heart. About 2,000 are done every year.
Wow. Jen, great to have you with us, especially as this comes out. Thanks.